Alberta's government has announced a new plan to change the healthcare structure in the province. Premier Danielle Smith says she is not satisfied with the current structure. Smith, along with several other health officials, laid out the province's new health reorganization plan earlier in the week. Here's just some of what the Alberta Premier had to say.
Starting today, we're creating an integrated provincial healthcare delivery system that concentrates on 4 priority areas: primary care, acute care, continuing care, and mental health and addiction. We believe that by creating specialized organizations within one provincial system, we will enable each organization to look after one area of healthcare only and avoid the scattered and uncoordinated approach of the more rigid, centralized structure that exists now.
For more on this, let's turn to Dr. James Talbot. He is a former Chief Medical Officer of Health for Alberta. He's also an adjunct professor at the University of Alberta School of Public Health. Dr. Talbot, thank you for making time for us.
Thanks for having me.
Dr. Talbot, can I begin by getting your reaction to the Premier's announcement to reorganize the healthcare system?
Well, in contrast to what she announced, or what she framed it as, it's actually a disintegration of the healthcare system. It's a lot of smoke and mirrors. It's unlikely to make any difference to what the people of Alberta think are the real problems with the healthcare system. And it seems to be an exercise in blaming the Alberta Health Services for decisions that were made by the government itself.
Can we get into some specifics? What do you think are the problems, and what is it that concerns you about what the Premier is proposing?
Well, if you ask Albertans what their top priority problems are with healthcare, they're pretty simple and they haven't changed recently, so the government should be aware of this. 1, they can't get a family doctor. 2, emergency rooms are too crowded. 3, waiting lists for surgeries and for treatments are too long. And then 4, in rural areas, they believe they have all 3 of those problems, but they have an additional problem, which is that it's very hard to attract and retain healthcare professionals in rural areas. So nothing that was announced in terms of shuffling things within Alberta Health Services is going to respond to those. If you ask experts what the 2 biggest problems are, they'll say that there aren't enough people in primary care, family doctors and nurse practitioners. Those are the people who diagnose us early and to keep us healthy and keep us out of hospitals, which is where the most expensive health care is delivered. And there aren't enough of those, so that's a problem for the system. And the second thing that they would say is that the number of people in acute care hospitals that should really be in continuing care beds is too high. And Alberta Health Services has been aware of that for a long time and has lobbied the government intensively for more than a decade that I'm aware of. And the government's refused to invest in the continuing care spaces and staff that are needed. So as I said, Alberta Health Services isn't responsible for those problems. And those are the things that most people would like to see some movement on in Alberta.
The AHS, or the Alberta Health Services, as you've been referencing, has been around for a short time, maybe 15 years. And prior to that, the province had regional health boards. So do you think, I know you're concerned about how this might move forward, but is there any space for reorganization so that certain areas get more attention and more funding? Is there any room for maybe reworking the system? Because clearly, as you pointed, there's a lot lacking and lagging.
Right. And so I think there is. The difficulty is that this isn't it. This is blowing up the system to make changes that could be done in a more intelligent, more effective, more efficient way. So regional health authorities were originally set up to provide better integrated, better coordinated care that was going to be more effective, was going to save money, and leave us with a better quality healthcare system. And so in the early 90s, they started down that path with regional health authorities. And as you said, it reached its apex with Alberta Health Services. So what the government is saying they're doing to disintegrate the system is, in fact, what they said was the reason to integrate it in the first place. So what are the things that need to be done? They need more people in primary care. That's not Alberta Health Services, that's family docs and nurse practitioners. So they need to be talking to doctors and nurses, particularly family doctors who provide the bulk of that. They can make more funding available for continuing care, and if the creation of this new group is followed in the next couple of weeks by a promise by the government that they're going to create, or they're going to give the funding for new healthcare beds, and that those continuing care beds will be equal to the number of acute beds that are occupied by people who don't need it, that would be a step forward as well. They've talked about increasing the funding for mental health and addictions. Well, that would be important. But the two biggest problems there are homelessness and fentanyl, which is busy killing Albertans every day. And again, that's not Alberta Health Services that's responsible for that. Homelessness, the government can take responsibility for right now and do something about it. And they could do significant amount of work on fentanyl, working on the prevention side, which they refused to do up until now.
Let me ask you about a concern that keeps popping up with these conversations. The NDP has pointed out that this direction, this plan, could lead to increased privatization of our healthcare system, in this instance in Alberta. What's your read of that?
My concern is that it's a stealth approach. And so if they continue to blame other people for problems that they themselves created, then the healthcare system continues to frustrate Albertans because they can't get a family doctor, they can't get in for their procedures, the emergencies are too crowded. And then people who are increasingly frustrated look to solutions, anything that's different. We know privatization has some real problems attached to it. We know that it steals people from the public sector to the private sector, so it's going to make all these manpower problems worse. We know that it gets to the point where the level of healthcare you get depends on how much money you have, which philosophically is something that Albertans and Canadians abhor. But the other part of this that I think is kind of insidious is that they're blaming Alberta Health Services, and by and large, Alberta Health Services has some things that it could do better. But if you look at its performance over the last 3 years, from the management right through to the front lines, it's been outstanding. I mean, these are people who put their lives on the line, who are concerned about their family's safety. There are doctors and nurses who were in trailers at the end of a work shift because they didn't want to bring COVID back to their families when there was no vaccine available, who at the end of COVID, after 3 years of slogging it out, got harassed on their way to work. And they were nothing less than compassionate and professional throughout that entire time period. To have them blamed for things that the government has done is just unconscionable. And they've worked the entire time with that kind of professionalism and excellence. They deserve better politicians than this.
Okay, Dr. James Talbot, thank you so much for your time and for your expertise on this.
My pleasure.
Take care.